Welcome to the Maternity Mentor. Today we will be talking about 7 common newborn rashes, what you can do about them at home if you see them, and when you should call your pediatrician. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I am also an IBCLC. I am maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Newborn rashes are very common. Some develop within a few hours of life. Others can start before the baby is even born. Let's explore what causes these rashes and how to treat them. Newborn rash is often referred to as erythema toxicum. It usually starts within a few hours of birth. Parents will often call the nurse saying their baby looks like they have been bitten by mosquitoes. More than half of all babies will develop newborn rash. The cause is considered unknown, but babies have very sensitive skin after birth. Until that moment, their skin never touched blankets, diapers, or even other people's skin. These new textures and materials can cause a sensitivity reaction. Newborn rash is usually red patches that have white or yellow pimples. They can develop anywhere, but most often are seen on the body of the baby. They can look really bad, which is why it's so distressing to parents. These patches should disappear on their own in 3 to 4 weeks' time. The most important thing is not to pop the pimples. This could lead to infection or scarring. No treatment is needed for erythema toxicum, and in fact, using ointments and baby oil can actually make it worse. It's best just to leave it alone and let it go away naturally. Baby acne is exactly what it sounds like. It's white or red pimples on the baby's face. It typically appears on the forehead, but can also be seen on the cheeks, nose, and chin. It occurs in approximately 30% of babies. The cause is unknown, but it's thought to be exposure to maternal hormones in utero. No treatment is necessary or recommended. Neonatal acne should clear up in a few weeks. However, some cases have been known to last a few months or more. Again, baby oils and ointments will often make the baby acne worse, not better. 40% of babies are born with or develop milia. Milia are tiny white bumps on the face and nose. They will sometimes be seen on the forehead and chin. They look like pimples but are much smaller. They are caused by blocked up oil glands. As the baby's oil glands get bigger, the glands will open up. Once this happens, the bumps will disappear. This usually happens anywhere from a few days to a few weeks. No treatment is necessary. Ointments and baby oil will only make them worse. Before we continue, please remember to hit the like button and subscribe so we can continue to create this content. Now let's talk about heat rash. When a newborn rash doesn't have a clear cause, it is often a heat rash. Heat rashes or prickly heat are pink and blotchy with tiny bumps. They are usually found on the face, neck, and chest. They can also be found in other areas where sweat gets trapped, like the diaper area or armpits. Red patches may have a smooth texture or may be slightly rough. Heat rashes often occur during hot weather when the sweat glands get blocked off. Some of the things that can cause this include applying ointment to the skin, friction from clothing, and the baby being overheated. Sometimes a baby being held against a mother's skin while nursing can cause face rashes. Heat rashes are generally self-limited and do not require treatment. Some things you can do at home to help include bringing the baby to a cooler place, removing layers of clothing, dressing the baby in looser clothing, and giving the baby a cool bath. Diaper rash is red, sore skin on your baby's genitals or bottom. The most common cause is being left in a wet or dirty diaper too long. Some things you can do at home to treat diaper rash include applying diaper rash cream or ointment with every diaper change, letting your baby's bottom dry out between diaper changes, and changing the baby's diaper more frequently. One thing to avoid is using cornstarch or baby powder. When applied, the baby will breathe in some of the small particles and it can harm the baby's lungs. Sometimes a diaper rash will progress to a more serious yeast diaper rash. This rash is bright red with smaller red bumps or spots. It is caused by a fungal infection that grows in the moist, dark areas of the diaper region, basically the folds of the skin. If you have a diaper rash that doesn't go away with typical home care after 2 to 3 days, you should suspect a yeast rash. This rash needs to be seen and treated by a doctor. They will usually give you a medicated diaper cream to apply to the rash. Pustular melanosis is a common newborn rash that develops in the womb before the baby is born. It can be seen in all babies, but it is most commonly seen in African American babies. Pustular melanosis is small pimples on the skin that are filled with a cloudy liquid. When they burst, they will leave a dark circle or patch on the skin. When a baby is born, you may see some that are intact and some that have burst. They are usually found on the forehead, neck, back, and chin, but can be located anywhere in the body. Pustular melanosis does not require treatment and it will usually disappear within 2 weeks of birth. Cradle cap is also called seborrhea. It usually shows up at 1 to 2 months of age, but can show up earlier. It's a thick yellow buildup on the top of the baby's head. It's crusty and scaly and has a greasy appearance. Cradle cap is caused by the normal buildup of oil, scales, and dead skin cells. Home care for cradle cap includes brushing the head with a soft bristled brush to loosen the scales, and then washing the baby's hair with mild baby shampoo. If the scales are difficult to remove, you can apply mineral oil to the baby's scalp. Leave the oil in place for a few minutes, then brush the baby's hair and shampoo as normal. Most newborn rashes are mild and do not require any treatment. However, there are times when you will need to see your baby's doctor. Contact your doctor if you see any of the following signs or symptoms with your baby's rash: cough, lethargy or weakness, excessive fussiness, poor feeding, swollen lymph nodes in the neck, armpit, or groin, and fever. Additionally, contact the physician if there are red streaks extending from the rash, there is increased pain or swelling around the rash, or the rash is warm to the touch, or if the skin looks infected with the presence of sores or pus. There are 2 specific rashes or skin conditions of special concern. If you see these, you need to contact your doctor immediately. The first is purple or red pinpoint spots or dots. These would not have been present at birth. These are called petechiae. They can appear anywhere on the body. If light pressure is applied, they don't change or lighten in color. These are considered serious because they can be caused by a viral infection or a very serious bacterial infection. The other rash parents should take note of appears as tiny blisters. Blisters are little bumps filled with clear fluid, sometimes yellowish in color. They may be grouped together and will often look like cold sores. After several days, they usually start to crust over. The most common part of the body where they are seen is the scalp or face. They can appear within the first 2 weeks of life. This is herpes simplex. If you suspect herpes, you want to contact the pediatrician right away. Early antiviral treatment can help prevent serious problems in the baby later. Herpes simplex may seem like other mild rashes, so it's important to have the doctor examine your baby to determine which rash you are dealing with and the appropriate treatment. Newborn rashes can be very stressful for parents when they develop. However, most are mild and go away without treatment. I hope this has explained the differences between newborn rashes and when to see the pediatrician about them. Please share your comments and let us know what topics you would like to hear more about. If you like this content, remember to hit that like button and subscribe so you can be the first to receive this information. Remember, share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.